Hello, I am Dr. Aaron from the Hair Center of Turkey Clinic. I am an anesthesia specialist. Today, we will answer the question of whether patients with chronic kidney failure, whether they are on dialysis or not, can undergo hair transplantation. Chronic kidney failure is a condition with many causes, sometimes treated with just a few medications, and other times requiring dialysis treatment. We need to check some laboratory tests before the procedure in these patients. We need to check electrolytes such as urea, creatinine, sodium, potassium, and chloride, and in some patients, liver enzymes. If our patients' tests are suitable for the procedure and they do not have any bleeding disorder, we can safely accept these patients for hair transplantation. There are certain aspects we pay special attention to in these patients. Under the supervision of a specialist doctor, we closely monitor and strictly control their blood pressure, heart rate, and oxygen levels to maintain their fluid and electrolyte balance at optimal levels. We neither allow the patient to be dehydrated nor to be overloaded with fluids. If our patient is undergoing dialysis treatment, we consult with their nephrologist to ensure they receive their dialysis before the procedure. We perform the hair transplantation the next day and then direct them back to the clinic for their dialysis treatment the following day. Patients with kidney failure are particularly at risk for fluid deficit or fluid overload and may be immunosuppressive, making them susceptible to infections. We take all necessary precautions regarding sterilization and fluid electrolyte balance to accept these patients for hair transplantation procedures. If you have any questions about this, please mention them in the comments.